Okay, so now next let's talk about a checklist of things you might want to pack with you for the day of the treatment, or things that you might want to consider. Alright, so let's talk about things you might want to pack. So you might want to get your health insurance card and your photo ID. Most places ask you for your photo ID and your health insurance card. Any tests or reports that you might have got done at another facility that might be needed for your visit here. Any doctor's forms like intake form or reports that you might have been asked to complete beforehand. Any medical records that are already not at the facility. What else? Your list of questions, so that you don't have to scramble and think about it. What else? And your checkbook or credit card. Usually most people have this information with them. Okay, and then if you're going to be getting your treatment, the other thing is that this is your first visit, and your doctor or your nurse might be doing teaching. You can take a notebook to make notes, or if you are an audio learner and the facility will allow you, you can audio record. So you can pack an audio recorder with you. A lot of times if you have a smartphone, many smartphones have applications for audio recording. Okay, and you might want to pack food with you if you're going to be there for a long time. Usually I would say that expect to be at your hospital or at the center for much longer than you anticipated. Sadly, there is a lot of waiting at most places. So you might want to find out about your food, if you are allowed to eat beforehand, and then if not, then what you want to pack and bring with you. Many of the hospitals and centers might have a microwave where you can warm up the food. So you might be able to get something with you, food and obviously water to hydrate yourself well. You might want to bring something to entertain you, so a book or DVD or your iPad, something that will help you to pass time. You might want to bring your medications. So if you are on any pain medications and you think if you're sitting for a long time you might have pain, bring your pain medications. Or if you're on medications for blood pressure, bring those. If you have already picked up your prescriptions, then that's another good set of medications to bring with you, so that when you're going through the teaching you actually have the bottles with you. Alright, what else? Let's see. Okay, in terms of what to think about, think of who's going to drive you back and forth. If your treatment is long, or if you might be tired of your treatment, who's going to stay with you. And who's going to care for your family if you're going to be gone for some time. And clothes, I recommend wearing comfortable clothes, because you might be at your treatment for a long time with layers. Most places will give you a blanket or a pillow so that you can relax and be comfortable. But the temperature varies, so it's nice to wear layers so you can be comfortable. What else? Yes, very, very important to hydrate. So when I say hydrate, I suggest that from the night before and the day of the treatment, start to drink 1 to 2 liters of water. So about 2 bottles of those 500 cc water bottles, and that will really, really help you with starting the IV and being able to get in right away, so it's not as painful for you. Plan to leave early and get there early, because a lot of times there might be traffic, or hospitals sometimes can be confusing to find your location, find parking, and there might be a little bit of walking. So plan to leave a little bit earlier and plan to be there for much longer. So unfortunately, a lot of times there is delays and wait at the doctor's office. So before seeing your doctor, you might be waiting for a considerable amount of time, or you might be waiting for a good amount of time before you get your chemotherapy, or there might be something that comes up where things take longer. So plan to be there for much longer time than what you're thinking, and how you're going to accommodate for that. Bring your smile and positive attitude. It's going to be a good treatment and a good day. Oh, and last thing, if you're uncomfortable about something, please let the staff know, so that they can address it for you and help you to be comfortable.